Hi everyone, talking a little bit more about nerve conditions, nerve entrapments, and today, we're going to talk a little bit more about tarsal tunnel syndrome. We're going to talk a little bit about the patient positioning for for treating nerve conditions, as well as the protocols that I typically undertake there. Hopefully this will help you to decrease your patient's pain a lot quicker, getting them moving and then not missing anything whilst you're undertaking that treatment. Or whilst you're doing your broader treatment over several weeks. Start thinking about, okay, well, where do we want them positioned? In the case of a tarsal tunnel syndrome, I like my patients to externally rotate their leg as comfortable, and I like to tilt that chair up so that I can make sure that ergonomically I'm in a really safe position as well. When we're starting to treat there, we've got some fantastic settings like pain and biostimulation. And our pain setting is going to really remove a lot of the pain straight away. And the biostimulation is going to make sure that we're healing and reducing the rate of healing or increasing the rate of healing and reducing the pain in that local area. But always we need to be aware of where's something coming from. And if it's a space occupying lesion like a ganglion, then that's where we might need to consider, okay, well maybe an anti-edema may be a better option in that area. Similarly, we need to think about what proximal influences there may be. And particularly in tarsal tunnel syndrome, there may be an FHL sort of concern or a post-tib concern that may be causing some tightness around that tarsal tunnel. So start going up into those muscle bellies and really having a bit of a feel about what's tight there and whether we might be able to release that through our trigger points and potentially a contracture setting as well. When we're starting to look through those aspects as we are right now, you can see that I'm treating very broadly again. Now this is going to ensure that I'm not missing anything. That biostimulation and anti-edema, it is going to release all of those tissues a little bit as well. And that's going to put us in a much better position to make sure that we're not having any concerns into the future. Hopefully this will allow us to really make sure these patients are out of pain as quick as possible. Now, in conjunction with our offloading and changing to biomechanics, hopefully this puts our patients in a really strong position for moving forward. But that's one of the protocols that I use quite often, particularly in conjunction with our heel pain protocol or that plantar heel pain syndrome, and really thinking more broadly about, okay, well, what is contributing to this pain? Think about those proximal muscles and the tendons that may be going through that area. And a similar sort of thing happens with Morton's neuroma. Think about whether that actually may be coming from the tarsal tunnel, or maybe there's some tightness in that area from our intrinsic muscles, and then start thinking, okay, well, how can I best target these? And laser is one of the best ways that we can really more broadly start treating some of these aspects as well. But with the real goal of reducing the pain, release the entrapment wherever that may be coming from, and not forgetting about the biomechanics. So really treating holistically when we're looking at that. But today has been nerve conditions with an example of the tarsal tunnel syndrome. I look forward to chatting in the next session. Cheers.